The cognitive story, I think, is interesting and still playing out. And I know at least our group is hoping to get funding to do more in-depth studies of this. But what I can say is, for example, our group and others have looked at some biomarkers of neurodegeneration in the acute phase. We looked at neuronal markers like tau, p-tau181, which is a specific marker for Alzheimer's type pathology, NFL, which is sort of an axonal marker, GFAP, which is a glial cell marker, and UCHL1, which is also a neuronal marker. And we looked at these early in hospitalized people. And those markers were elevated in patients that had neurological complications, like encephalopathy, and were elevated in people who died and lower in people who were able to go home. And the markers, when we compared them to control groups of patients that were pre-2020, so pre-COVID, patients who had been diagnosed with mild cognitive impairment or Alzheimer's, these levels were much higher than even what the Alzheimer's patients had. So, it's like, wow, the serious insult happened. And I think people are interested in identifying something that behaves like a brain troponin to give you a sense of like the degree of injury that person had and how much that will predict their long-term outcomes. We're still looking at our data to see how these markers correlate with how these people did 6-12 months later. But there's a concern that a certain proportion of people, probably not the majority, but a certain proportion of people, that this virus could trigger a cascade of neurodegenerative events. So we know that, for example, hypoxia, just having low oxygen, can trigger gene cascades and hypoxia-inducible factor 1A related gene cascades that can upregulate production of amyloid and decrease breakdown of amyloid, so you can get more amyloid burden. Hypoxia can also induce neurofibril tangle formation. These are two pathological hallmarks of Alzheimer's type dementia. We know from pathology studies acutely after COVID that there's microglial activation in a lot of these patients who died, and the microglia release a number of cytokines and inflammatory response. It can kind of rev up this whole process of amyloid deposition and decreased clearance of amyloid. So I think there's certainly conceptual factors that could lead to neurodegenerative processes. Whether that actually happens or not, we don't know yet. We don't really have much pathology on people with post-acute COVID or brain fog who died and then we looked at their brains. We don't have enough data of that sort to know if pathologically this is happening. But it is an area that I think a lot of us are interested in kind of digging into a little bit more. There's this viral theory of Alzheimer's disease that predates COVID in general, that is related to an inflammatory response that can lead to the neuropathological issues that I had just kind of described. So conceptually, it's a possibility. Hopefully that is not the case for most people who've had COVID, because that would certainly be a very severe consequence. But there might be a subset of people who are predisposed to, unfortunately, develop this pathology.